women are frequently called back for additional views after they've been in for a routine mammogram. And this is something that women come and tell me is frightening to them, and that's understandable. When a routine mammogram is done, the technologist takes images of each breast, usually in 2 or 3 different views. And those are the standard images. If anything shows up on your mammogram, then that would be a reason why the imaging center would call you back to have additional mammogram views, and also probably an ultrasound of your breast. And while this is frightening, this is something that's not uncommon. The number of women that are called back from a routine mammogram is around 9% of the time. So it's not unusual at all. And then the further workup, most of the time, turns out to show nothing abnormal. A number of different things can show up on mammograms. Sometimes the breast tissue itself, the glandular breast tissue, looks funny, overlaps on itself, can look like a little lump, or there can be a question that there's a tiny little calcium spot. And so most of the time the additional imaging will tell the radiologist that there's actually nothing wrong and nothing abnormal going on. Sometimes there are abnormalities that show up on the additional imaging, but the radiologist looks at and says, that looks benign, that does not look like a breast cancer. And those are things like cyst and sometimes little fibrous growths in the breast. And so those questions get answered on the additional imaging. Sometimes a suspicious abnormality is found, and that is a situation where the radiologist thinks that there's something on the mammogram that may possibly be a cancer. So while callbacks are frightening, the fear of that, don't let that be a reason not to have your mammogram done. And if you have questions about what showed up on your additional views, ask someone from your care team to explain to you exactly what they were seeing and how the conclusion was arrived at, that the radiologist interpreted the final readout of your mammogram.